Thomas. I'm a consultant in Orthopedics and Joint Replacement Unit at Sant Paramanand Hospital, Civil Lines, New Delhi. No, in fact not. There are multiple treatments for osteoarthritis depending on the age of the patient, the problems of the patient, the pain that the patient has, and the patient's other body problems. We have multiple treatment modalities like medicines, physiotherapy, local injections into the knee joint. Only when the patient has got all the treatment and still he or she has pain, then we advise a surgery. And that surgery is a total knee replacement. The surgery is a good option, but it is a last option. In modern times, this surgery has become very refined. Patients come walking to the clinic, they get admitted, the next day morning they get operated, and immediately after one day, they are starting to walking. They start to walk around the room the next day after surgery, and in 2 or 3 days they are even going to the bathroom. They're able to sit in the toilet seat and they are able to climb the stairs also. By the time the patient walks around, he is relatively pain-free and he is able to walk around without anybody else's support. He or she may need a walker to walk, but no other assistant is needed. Yes, of course. We plan this surgery and we try to do surgery in those patients in whom we want to give as normal a life as possible. With modern orthopedics and modern implants, these patients are able to lead as good a life as they had many years back with their normal knees. There are people who roam around the world, who go on mountaineering, who go on hiking, and people are able to do their daily activities, go dance in the club, play around with their children and their grandchildren as much as they want. There are certain restrictions which we ask the patients to take care, because we want the joint to last for a long time. But those are very minor, and if the patient listens and understands those restrictions carefully, then these joints will give them a very happy and satisfied life. See, over a period of time, we surgeons have realized that no two patients are similar. The knees are different, the sizes, the height, and the functional demand of the patients is different. So we realized that every patient cannot be given the same knee. So, customized knee implant and personalized knee solution is the in thing. With these implants, so the knees that now we have are in multiple sizes. The number of sizes has increased, and patients are able to get a knee which is very, very similar to what their natural knee was. This gives an improved range of movement, a better quality of life, and better rehabilitation. A good sizing implant means that the patient will have very little pain and he will feel as good as a natural knee in the post-operative period. Computers, as we know, are now in our daily lives. So is in the surgical field too. The computerized pods are able to help the surgeon take a better cut. They are able to help the surgeon take critical decisions and fine-tune the surgical procedure so that the patient gets a knee which is as good as his natural knee that he had for so many years. The computerized system as well as the personalized system is the in thing, which is here now, and it is going to remain for life. This condition is a very treatable condition. Don't be scared, surgery is not the only option. It is the last option even for the best of the surgeons. We will try to do all possible things so that your knee can be avoiding a surgery. But if it comes to that, surgery is a good option and it should give you lasting, comfortable, satisfactory life. Paramanand Hospital, we do more than 1,500 knee replacement surgeries a year. There are many patients who have gone back to their daily lives and come back to me saying that because of hearsay and various myths, we have been avoiding this surgery. Now, after they have undergone the surgery, they realize that it was not such a big deal as they actually thought it to be. So I would tell to all patients that if you are having a problem, feel free to come and talk to us. Maybe after talking to us, you will feel that this surgery is not as big a deal as you ever thought it to be. To give you a personalized, Joint replacement solution with world-class technique is a dream for all of us at Sant Parmanand Hospital.